Back now talking about breast cancer and Breast Cancer Awareness Month, which is October. We want to focus on some ways that you can prevent or at least lower your risk of breast cancer. So here to talk more about that is Dr. Patricia DeFusco, medical oncologist from Hartford Hospital. Good morning to you.
Good morning. Thank you for having me.
Some interesting things are happening, and you're saying that there is a drug with a new indication that's really important that people should know about?
There's a drug named Perjeta, P-E-R-J-E-T-A. It was a drug that was has been FDA approved since the beginning of this year for advanced breast cancer, and just received a new indication for what we call neoadjuvant or upfront treatment of women who are newly diagnosed with breast cancer. Perjeta is a drug that blocks the protein HER2. HER2 is a protein that spans the membrane of the cancer cell, and if it's present, which it is in about 20% of all breast cancers, it can make the cell behave more aggressively. The standard drug we've used to treat HER2-positive disease is a drug called Herceptin, and we have more and more evidence that if we combine the Herceptin with another drug that also blocks the HER2 but in a different manner, we can have greater efficacy.
Oh, that's encouraging.
Right, it's very encouraging. And HER2-positive disease, while it is a more aggressive breast cancer, Perjeta is just one of a number of drugs that have just been recently approved for treatment of HER2-positive disease. So while it's maybe a small area of breast cancer, it's one in which we have new tools and new targets. So it's very exciting.
Yeah, exciting, encouraging, and hopeful. And that's what we always want to focus on when we focus on Breast Cancer Awareness Month. We also want, you know, so many times people say, well, what can I do? There's sometimes nothing that you can do that's going to prevent it altogether. But how can we lower our risk?
Well, there are a number of things that can be done. We know, for example, that there's more and more data coming out that alcohol can increase breast cancer risk. There's a study out of Dana-Farber that suggests that even moderate use of alcohol may increase breast cancer risk. And moderate's actually considered 3 to 6 servings of alcohol a week. And to make it worse, what they consider a serving of wine is only 4 ounces.
My goodness.
There are national guidelines that say no more than 1 drink a day. So I think we're in a little bit of evolution, but clearly maybe limiting alcohol intake may play a role.
And does it say what % that increases your risk?
I think what we're seeing is more of a trend that it can increase. And actually what's interesting is this trend can be seen not only in this country but in Europe, because one might think that in, you know, Italians and French, where this was more of a usual use of alcohol with meals, that it might not see that trend, but we are seeing it.
You are seeing it. Yeah. That's interesting. So we might be hearing more about that in the future. We might be hearing
more about that.
What are some other things that that we can do, maybe lifestyle things?
Well, diet and exercise have become more and more important. And again, there's more evidence that whether it's reduction in the intake of saturated fats or exercise or just losing weight, that those things may help to decrease breast cancer risk. We know, for example, that you can make estrogen in body fat, so that if you can lower body fat, that might be very helpful in reducing risk. So that's a little harder to quantitate because just the technical aspects of doing those studies may be a little bit difficult, but clearly there's benefit to maintaining an ideal body weight and to losing weight. So we encourage that. There's some evidence that aspirin and aspirin-like drugs may have an effect in lowering breast cancer risk. That's a little less clear, and we have to be careful because of the risks associated with aspirin-like drugs. And also there are medications that can be used to decrease breast cancer risk. Starting about 20 years ago, we started our first breast cancer prevention trial, and that was a trial in women who were at high risk, either based on age over 65, family history of breast cancer, or other risk factors. And women were randomly assigned to tamoxifen versus placebo. And that trial showed that tamoxifen decreased the risk of developing an invasive breast cancer by 40%. It was the first time we really showed that a medication could lower cancer risk. Tamoxifen obviously has many side effects. There have been further evolution of the trials. Raloxifene, which is a drug that's used to treat osteopenia and osteoporosis, has been shown to equivalently decrease the risk of breast cancer in the short term, although longer term it may be a little less effective than tamoxifen, but clearly the risk profile is better. Less risk of uterine cancer, less risk of blood clots with raloxifene.
So all the money we're hearing constantly is going to breast cancer research. A lot is happening. There's a lot of good coming out of this.
A lot is happening, and I think what we're learning more in the future, I think, is going to be in what we call genomic research, and really understanding what makes these breast cancer cells tick. What are the aberrations going on within the enzymes and within the cells? And if we can find ways to target them, we can hopefully find much more directed treatments.
Encouraging. Thank you, Dr. DeFusco. We appreciate you coming in.
Thank you.
All right, so what's on your